what is needed provincially is truly provincial integrated antimicrobial stewardship programs. I can speak for Manitoba. We don't have that. Typically, most places that I go, you'll have antimicrobial stewardship programs located in the hospital. Perhaps they serve a variety of different hospitals. It's a regional hospital formulary stewardship program. These programs typically are underfunded. We need way more teams of infectious diseases and clinical pharmacists working that are truly funded to make these programs go. I see virtually nothing happening on the outpatient side, which is 80% of antibiotics. There's very little antimicrobial stewardship that occurs there. I think the biggest thing the provinces can do is be focusing on what they do, infection control. And I think we're very good at that internationally, not just within the different provinces, but we're very good internationally. On the stewardship side, we have a long way to go. And I think the province, working with the institutions, the hospitals, and the outpatient clinicians, really needs to get their act together on the stewardship side, because we are not doing that. Nationally, I think nationally we've seen that we can really work well nationally and provincially when it comes to things like COVID-19, right? The SARS outbreak has showed how the provinces work federally. We're not doing that on an antimicrobial stewardship side. Nationally, I think what we're doing well is surveillance. The feds, we work with the National Microbiology Lab here across the street, and they're very, very good at working with us to do national surveillance, looking at where are these resistant pathogens in the different provinces? Are they genetically similar or genetically different? What kind of antibiotics are they resistant to? What kind of infections do they cause? What are the risk factors to acquire these particular infections? So I think on the surveillance side, the feds have to be involved, and they need to partner with research groups like ours and others. And I think they're doing a pretty good job. On the provincial side, I think the biggest thing we're missing is stewardship. We're doing well with infection control. I think we need to do way better with stewardship. And I think the feds ideally would also work with the provinces to create some sort of real standards of what stewardship should be, not just in the institutions, but also in the outpatient clinics and outpatient practices.
That's great summary. Dr. Thirion, how about you? What are your thoughts, given your experience in Quebec?
Well, I think I can tag off from Dr. Zhanel at this point because I share the same concerns concerning the antibiotic stewardship programs. And if we look at those programs, I think some of the most important initiatives are to make sure that everybody's trained appropriately. So we do need interventions from our antibiotic stewardship program, who I would assume are experts in intervention, go out further into primary care, first-line therapy, first-line interventions, where our pharmacists, general practitioners can adopt those principles and practice easily. If they're not well trained, those frontline workers, they don't understand what's happening with the interventions, don't see the importance of those interventions, and will not apply them. And so I think first we have to get those guys trained. Second, I think we have to improve our criteria for accreditation of hospitals and communities in regards to antibiotic stewardship. Those interventions are actually critical because right now the accreditation levels are too low. And as George was saying, we're not having enough appropriate or optimal interventions from antibiotic stewardship. They're going all over the place. And they do one intervention or they do one surveillance issue, and they're satisfied with this. They meet the accreditation criteria for Accreditation Canada. And actually, we want them to make the best practice in antibiotic stewardship. So using the optimal intervention that has the highest impact on preventing the emergence of resistance and improving patient outcomes. Now, so that's for the antibiotic stewardship piece. Now, I just want to go further along from our provincial governments. You have to make sure we have access to the medication and diagnostic techniques that to be able to do our practice. And that's a huge issue because there's a lot of tests out there that we could do, viral panels that we could do for respiratory tract infections. Right now, we're doing them in research, but it has to be rolled out for the primary care physicians.
Mhm.
And the medication, while we're the critical medication for the most resistant bacteria, are approved in Canada, but not available. And I think the governments have to make sure that we can have access to them. And there are several molecules that become critical for those patients that we don't have access to. They're not approved. And from the federal point, that causes a lot of delays for the patients that need them.